Covert narcissism, when it becomes restored for most individuals, it's that vulnerable tendency, it tends to flip to more of that grandiose narcissism. So we have covert and vulnerable. And then on the other side of that same coin, we have overt and grandiose. Hey, it's Dr. Fox, and let's get into answering the question, is covert narcissism just quiet BPD, borderline personality disorder? Well, let's look at it and figure it out. Well, let's first go over some of those similarities between the two. Now, what about underlying emotional instability? Now, both quiet BPD and covert narcissistic individuals, they both experience emotional instability, although the reasons and manifestations may be different, which is that a lot of times in covert narcissism, they still have that underlying component of shame, guilt, fear, doubt, and inferiority. And when those core components, those core content components get hit, right, they get activated, they can act out in an aggressive way, in a violent way. But remember, we're talking about covert narcissism. So your covert narcissist, a lot of times, the way they will act out is they may say how hurt they are, how broken they are, how uniquely they're suffering. And it can add to this emotional stability. Could be more crying. Could be some narcissistic rage components. That is true, but we're more likely to see more crying, more of a display of hurt that we see more out of the covert narcissist. Now, when we talk about quiet BPD, when individuals fall in this particular realm, and their core content is often abandonment, rejection sensitivity, and emptiness. Now, when those get hit, certainly that drive can be to have that safe object, could be a therapist, could be their favorite person, could be a significant other, could be a coworker, a friend, family member, whoever it may be, but to pull them closer. So then you get a lot of chaos in acting out to draw that person closer. But the quiet BPD component, and these folks are stuffers. So what it means is that they may be stuffing more inside, that it may increase their negative self-talk. This may increase their negative self-contempt. And what happens is that then that emotional instability, it's being pushed more inside, which means that there's more pressure internally until they finally explode. And that outward expression could be self-harm, could be violence towards others, whatever it may be. And if it's a quiet BPD type, this acting out, an aggressive emotional instability acting out, is often uncharacteristic. It's what people don't expect, because the quiet subtype of BPD for individuals along the borderline personality disorder spectrum is not what people expect. So the next one, let's talk about interpersonal challenges. Now, interpersonally, because we're talking about the similarities, right, of covert and quiet BPD, both disorders entail stable and healthy relationships, again, for different reasons. Your covert narcissist, the reason why they like relationships and they're challenging is because they want a sense of nurturance, they want a sense of recognition for their pain and suffering, and that's the covert part, that they suffer so uniquely. So they want people around them who give them a lot of poor babies, oh, I can help you, I can do this for you and that for you. Now, for your quiet BPD individuals that are along that spectrum, interpersonal challenges could be very similar to what I mentioned before, that they stuff it. And we see they're stuffing more of that hurt, that core content activation. Could be more alcoholism, drug abuse, could be promiscuity as well. That could be a component. Could be a variety of other risky acting out behaviors, which challenges those interpersonal relationships, which makes them very difficult. So that goes back to that chaotic relationship that's pretty consistent across all subtypes of BPD. Now, the next component, this is that sense of insecurity. And insecurity, certainly both of these types of personalities, personality disorder types, have struggles, or they have difficulty managing this sense of insecurity that they have, this uncertainty. However, it stems from different sources, which is fear of abandonment in those with quiet BPD, as I mentioned, abandonment issues, rejection sensitivity, and emptiness. Or it could be fragile self-esteem, which we see in the covert narcissist, even though that's also present in your overt narcissist as well. Your overt's more of your grandiose and what we expect. Your covert narcissist here is that it's that vulnerable type and that fragile self-esteem. They both have it, but here. This is what's fascinating about the covert narcissistic type. So the covert narcissistic type, again, they really grab their need, their ego inflation, and their importance from the unique pain that they experience, the suffering that they experience. To activate this, and this is housed in that insecurity that I mentioned, right? Fear, shame, doubt, inferiority, guilt. And we see that that's that core content that we have to tap into in therapy. But that insecurity is a component of all of those core content issues. So we see that covert narcissistic individual, that they have these components, and we look at that sense of insecurity, try how they manage it. They manage it by inflating of that ego stability, that they feel better about themselves, or they feel safer, or they feel that they're managed their interpersonal relationships, how they see themselves, their relations with themselves, based upon how they get others to feel bad for them. They get others to recognize and give them attention and do things for them because they suffer so much. And for that quiet BPD, again, that sense of insecurity, absolutely, just as I mentioned, that abandonment, rejection sensitivity, and emptiness, absolutely. And it's absolutely there, that sense of insecurity. When are they going to abandon me? When are they going to leave me? I know they're going to reject me, and that's going to leave me empty. And that becomes this negative feedback loop that plays out throughout their life. But the quiet type, they don't act out. They're not petulant. They're not aggressive typically. So we see that they stuff it more, that sense of insecurity, and inside them, what happens, and I talk about in other videos as well, about this family in the head. And that's a concept that I learned from Lorna Smith Benjamin, an amazing psychologist and researcher who has treated personality disorders of all types for decades. And that family in the head component, what happens is that sense of insecurity. It feeds that BPD and it strengthens that BPD. So we see that the individual, even though there's a lot of internal chaos and there's internal insecurity, that it's actually getting stronger. That BPD, those beliefs about self, about having low worth, about being unimportant, about having the sense of brokenness, all of that becomes stronger. But because it's the quiet BPD type, on the outside, we don't really see it. So they suffer and feel pain quietly until they explode. Now, the other similarity between these two personality types is potential for manipulation. Now, while their approaches and their behaviors may differ, both quiet BPD and covert narcissists resort to manipulative behavior in their interpersonal interactions. Now, I think when we talk about manipulation, we have to be clear, because the word manipulation implies clear intent to trick the other individual into doing something they wouldn't normally do so that that person can get their needs met. I think we use manipulation, particularly as it pertains to personality disorders. We say, oh, they meant to do that. But here's the thing, is that quiet BPD and covert narcissists, as with all personality disorder types, have impaired insight. I don't know that they have that level of sophistication, but if we take out that sense of intent, and you have to, this is a question for you to answer, please add it in the comments, but it's easy to say, oh yeah, they meant to do that. But are they just trying to get their psychological need met by using these maladaptive beliefs, behaviors, and patterns, and by having individuals in their life that tend to do things for them or provide different resources for them or opportunities or whatever it may be through their very poor behavior, whether you're a covert narcissist crying, saying how worthless they are, how broken they are, how dysfunctional everything is, and how their life just absolutely suffers. And then people feel bad for them, and they do things for them to help them out. And then you realize that there's a sense of insincerity there, because covert narcissism, when it becomes restored for most individuals, it's that vulnerable tendency, it tends to flip to more of that grandiose narcissism. So we have covert and vulnerable. And then on the other side of that same coin, we have overt and grandiose. So what happens is that as that sense of manipulation, or as people feel like they're being manipulated, but then that vulnerable narcissism, as the individual starts to repair their self-esteem, or they start to get that narcissistic component of themselves met, we see that coin flips to a more grandiose type of narcissism. And that's where people get frustrated and they're like, hey, you've been manipulating me. You don't feel that bad about yourself. You're full of do-do-do-do-do-do-do-do-do. right? And those are all the curse words, just so you know. So let's look at quiet BPD. Quiet BPD, we know that they're stuffers. They're putting things inside, keeping things inside, boiling up inside. Often they give in to others very easily. They are intensive people pleasers in a lot of cases. So we see that these individuals, and why they're people in their interpersonal circle feel manipulated, is because that need for abandonment, rejection sensitivity, and emptiness, it can drive them to have very short relationships, that they have this conceptualization that, well, I have to be secure now, immediately. So I have to do these things, and typically it's short-term reward, long-term consequence. So I have to do these things to get that emotional need met, so then I will feel safe and everything will be okay, and then the world will be great. But because it's so short-term, and they're always changing tactics, even though typically they're all maladaptive, so they're all self-destructive and destructive to relationships. So as they dissolve those friendships, romantic relationships, whatever it may be, the other people are like, hey, you're manipulating me. You're taking advantage of me. You're a jerk. Even though it feels very manipulative, and I get it, and I'm not in any way saying that we should allow people to take advantage of us or anything like that. That's not what I'm saying, because we're explaining how these two are alike. That's all we're doing. We're just relaying information. I'm not saying one is okay and one isn't, because blame and all that doesn't help. What we need to do is we need to help those individuals recognize their sense of self, to change and deal with that core content in a more adaptive and healthy way, so others don't feel manipulated, so others aren't getting manipulated. Boundaries is a great way to do that. Absolutely. Expecting or demanding in some ways, or encouraging, being assertive for clear communication on what their expectation is. But because these two personality types, like all personality disorders, have poor insight, it becomes very variable. So it's very, very complicated. So the potential for manipulation, absolutely, both of these types certainly have that. For other people to feel that way, absolutely. So this is the last similarity we're going to talk about. This is masking behaviors. Now, both of these personality types, they engage in behaviors to sort of hide their inner struggles or vulnerabilities. However, they do it in different ways. So your quiet BPD individual may exhibit avoidance and withdrawal. Okay, so this isn't your typical classic BPD type behavior where that person is acting out and where they are demanding that content, that person to come to them, that identified other, that favorite person. Help me, I'm struggling, and the world is burning down. And that person is supposed to come in, right, with a fire extinguisher and put it all out and make everything okay. But what happens for your quiet BPD is it is an avoidance and withdrawal. When that internal, that core content gets activated, then we see that they pull into themselves. Remember, they're stuffers, so they're stuffing things down. And again, it feeds that family in the head, that BPD, and it strengthens it, that avoidance and withdrawal. So they mask those behaviors. They may present as, yep, I'm fine, but it's just like that, right? Because you can tell something's going on with Jimmy or something's going on with Yolanda, but something, we don't know what that is because they're stuffing it. When we look at your covert narcissist, then we see that they display this false modesty sometimes. That we see that, well, I suffer so much and I've been able to achieve these wonderful things. I mean, these amazing things, even dealing with what I have had to deal with, even dealing with all the pain and suffering that I go through. I've been able to do that. Even with all of these things against me, I have been able to do this. And you can hear it clear as day, that vulnerable narcissistic component, all that they've had to deal with, all of that brokenness, all of that pain. But they're also saying how great they are because they've overcome it on their own. All right, now let's get into the differences. How do we separate these two? First one, let's talk about the expression of narcissistic traits. So covert narcissists exhibit this subtle expression of narcissistic traits, such as need for admiration and superiority. And the way they do that is, as I mentioned, when we're in the similarities part of the video, but they do that by explaining or saying how much they suffer, how much pain they have to endure, that it is not like anything else that anyone has ever had to deal with in the history of the world. And that's the narcissistic expansion of the pain of the vulnerable and covert narcissist. And then when we talk about your quiet BPD type, subtype individuals, we see that they typically don't display overt narcissistic tendencies because they stuff it. So we're seeing that differentiation. We're seeing an overt display, right, or a clear display of narcissistic tendencies here with your covert narcissist, but for your quiet BPD, we don't see that drawing attention to themselves, again, because it's the quiet type. So they're stuffers. They're stuffing it inside. They're quiet. Everything's fine. Everything's fine, but it's an inferno going on in their head. It is a battle of the bulge going on in their head. It is intensive battle. So the next difference, let's talk about focus of concern. Now, when we talk about your quiet BPD, the primary concern is that emotional dysregulation and fear of abandonment. And we talked about that, which is that core content of abandonment, rejection, sensitivity, and emptiness. So the focus for your quiet BPD individual are those three components. But let's take a look at our vulnerable narcissist, our covert narcissist. Now, for your covert narcissist, the focus is on maintaining that fake modesty that we talked about just a second ago. Also, and at the same time, you're seeking admiration and validation. It sounds so different, right? From your quiet BPD type to your, as compared to your vulnerable narcissistic type. We see that the individual who is the vulnerable narcissist, we see that they want that admiration, they want that validation for their pain, for their suffering, and what they've overcome. For your quiet BPD, that it's an emotional dysregulation, but it's a quiet, internalized suffering until they explode. Now let's talk about self-image. Now when we look at self-image, we see that this is very different in these two personality subtypes. We see that for your quiet BPD, we see individuals often struggle with fluctuating self-image and identity. It's very common for individuals that are along the BPD spectrum to really not know who they are, to have that unstable self-image. And we see this across all the subtypes. And if you want to learn more about subtypes, you can look at the Borderline Personality Disorder Workbook. It'll help you identify your subtypes. You can get a little more insight and understanding into it. But we still see that fluctuation of self-image, that uncertainty of who I am. It's just done in a very internalized, chaotic, internalized manner as opposed to an outward, petulant, or destructive manner. Now, when we look at your vulnerable narcissist, what we see that their self-image is more stable. It's not going to have that variability of fitting into this group or fitting into that group so I feel accepted and safe. Instead, your vulnerable narcissist, they're going to have that stability of suffering, of pain, of what they've gone through and how you should admire them. Now, it is inflated, and their self-image, they work hard to protect that, meaning that when you give them solutions or you give them suggestions on how to get better, to manage the pain, to do things differently, they don't do it. And that is one of the tricky parts of working with individuals with vulnerable narcissism, because we don't want to say they don't want to get better, but there is an indirect and direct reward for the narcissism. And this is true across all of us. What we do is we set up our lives to reinforce what we call personality. And that is our perspective of self, others, and the world that we live in. Well, if it's a disorder, if it's a personality disorder, and we're talking about your vulnerable covert narcissist here, what they do is they have that personality component, and they have set up their world. They've enlisted various people who fit into that, who are giving them the poor babies, and they're doing extra things for them so they'll be okay, and so on and so forth. And so we see that we have that stability of self and that self-image, but again, it's to protect that. It's to protect that image. So when you give them suggestions to deal with the pain and the suffering and so on and so forth, well, there's a part of them, because of the reward component, they don't do it. They're resistant to that. And certainly in treatment, that can be one of the most difficult areas to work with and manage. Let's talk about the next one, and that's our interpersonal patterns. Now, the interpersonal patterns of these two personality subtypes, they both struggle with interpersonal relationships. So we understand that. But the nature of these difficulties are different. And that is, for your quiet BPD individuals, they exhibit this intense, unstable relationship, which is marked by this idealization and devaluation. which is that when they meet people, they're still like, oh, this person is great. This person has that fire extinguisher. Remember I mentioned before that they just burning everything down. This person has that fire extinguisher to put it out and put out that fire and make everything okay. And then we'll feel safe and we'll feel secure and everything will be okay. However, on the other side, because of what we're comparing to, we're talking about vulnerable narcissism. We see here that it is an effort to sort of maintain this superficial connection centered around getting admiration. We see that the reason why they're connecting to others is that they want that admiration. It's not the safety component that you get or you see in the BPD type of individuals, but for your narcissistic, particularly your vulnerable narcissist who does it through saying they're suffering, brokenness, and pain, but they're doing it for admiration. So their interpersonal pattern, that interpersonal goal is different. Okay? So we see that as the underlying components are different. And lastly, let's talk about response to criticism. Now, response to criticism, for those that fall into the category of a quiet BPD, that we see that these individuals react strongly and emotionally to criticism, often due to rejection sensitivity, abandonment, and emptiness. You're right. So, but when we talk about that reaction strongly, because it's that quiet BPD type, it may not be outward. It may not be overt. It may be internalized. And what we're seeing is, again, it adds to that internalized pressure. So we see that pressure starts to build inside until they finally explode. But the quiet BPD type, again, because of that core content that I talked about, is abandonment, rejection, sensitivity, and emptiness, when that gets triggered, and it could be from criticism or perceived criticism. Doesn't mean that it is actual criticism, but the individual perceives it that way. And individuals along the BPD spectrum, regardless of subtype, when it is more of a neutral stimuli, they have a tendency to perceive it negative. They tend to look for the negative. Even if someone's trying to help, or the way they phrase it, or the way they go about it, that frightened tendency that I mentioned in the individual with quiet BPD, they're quick to feel rejected. They're quick to feel that they're going to be abandoned. They're quick to feel this sense of emptiness. So then they may initially stuff it until they explode outward. Now, your vulnerable narcissist, what we see is that they respond defensively or passive-aggressively to protect that fragile self-esteem that they have, right? We talked about what their core content is just a moment ago, right? Fear, guilt, doubt, shame, inferiority. And we're talking about that defensive or passive-aggressive. So if they feel this criticism that they've incurred that narcissistic wound, okay? If you're not sure what a narcissistic wound is, the narcissistic wound is that the narcissistic individual is told something happens to them, whatever it may be, but that fragile ego state, that narcissistic ego state, gets damaged. They feel insecure. They feel unsafe. They're not sure about what's going on. And that makes them not necessarily question it, like, should I be using these maladaptive beliefs, behaviors, and patterns, but it makes them feel unsafe. And that's what criticism does. So then they act out. How do they act out? Could be defensively. You don't understand what it's like to suffer as much as I have. You don't understand what it's been like for me to go through A, B, and C and all that other stuff. Or passive aggressive, which could be very, very destructive, which is that they go, okay, and then they can then plot, and this is absolute manipulation here, where they could then plot to make someone else's life exceptionally difficult. And when they do that, they feel empowered. They feel stronger. But that strength isn't typically enough for them to give up that vulnerable narcissistic perception or maladaptive management pattern, right? That keeps that covert narcissism in place. Not at all. So I really hope that this has been helpful for you. I hope this helped delineate those two subtypes of personalities. They are not the same. They are different, even though that they do overlap in many cases, but they are different. And certainly if you're dealing with an individual that has quiet BPD or vulnerable narcissism, there is effective treatment out there. Of course, the person has to be willing to accept the treatment, and that can be the hardest part, because the treatment is hard and it takes a long time. Working with a number of people over the last more than 2 decades. I've seen people do it. People have changed that quiet BPD pattern and that vulnerable narcissistic pattern that they've utilized to get through life to more adaptive strategies, ways to manage some insecurity, way to manage relationships, way to manage response to criticism, whatever it may be, in a more adaptive manner. So it is possible. It's absolutely possible. So I hope you enjoyed the video. Please like, share, subscribe, comment, and hit that bell. And I'll see you next time. Bye-bye.